Doc, I'm not taking a shot. That's what I said the first day that I was finally diagnosed by my lovely physician with this crazy disease, multiple sclerosis. See, I thought that I had it for like 13 years before. I mean, to the point where when I was 16, I already felt like I was having symptoms. Doctors, please take note of that. I think it starts way earlier than people realize. Needless to say, I finally got a doctor who listened to me, and that was the first thing I said. I said, I can't do the shots. And I think for me, the reason why I said that is because even just psychologically, I didn't feel like I would be any healthier sticking a needle into my arm or my leg or anywhere else all the time. I just couldn't do that. I couldn't, the thought of that just made me immediately feel like I was worse off than I was. So that's what I said. And thank God to this day, aside from, all my little, what do you call it, like baby puppy vaccines, but, whatever, the vaccines that you have to have, like for the flu, for pneumonia, for tetanus, or whatever those things are. Aside from those shots that happen very rarely, I do not take any shots. I take one pill a day, and that is an oral pill. I take it. If I miss it, then I definitely try and make up for it later on in the day or something like that, so that at least I'm on this pill regimen. And for me, it works. Now, I have to tell you that MS is not like a one-size-fits-all type of disease. We all know that by now. It's different for every single MS patient. There's no consistent form of the disease. All we know is a lot of times the symptoms are very, very similar, and it does still fall under MS. But as far as it being the same for each individual, that is not the case. So I want to talk a little bit about medicine. Now, you know the decision that I made, and that was, I was willing to even start on a trial medication that was an oral medication, one pill a day. I was willing to even start on that than to take any of the interferon shots or anything like that, because it's just, for me, I knew I couldn't do it. It would make me seem less of a person in my own mind if I were to do that. Now, if, again, MS is different for every person, so what you do, what works for you, but I want you to know that there's options. Nowadays, it's not like it was in the Stone Age. Now you have more than one option of treating this disease. There is no cure, but we do have at least multiple different options of what you can do. Let me pause for the calls real quick and say, for me, I had seen other MS survivors that were other brown people that were MS survivors, and the ones that tended to be on the shots didn't fare nearly as well as the ones that were on a one pill a day or two pill a day regimen. Now, the thing about it is that yesterday I went to a very informative medicinal dinner, so to speak, and about a new oral pill. And I try not to give exactly the names of each of them because I really don't just want to endorse one. I will endorse oral treatments, period, but I won't say exactly which one. I'll leave that for you to do. You can research with your doctor and talk to your doctor about the possibilities there. But what I did notice is that after listening to them, and this is already what I thought, remember, just I saw other brown people, that means African American, that means Hispanic, any ethnic group, essentially. Well, the ones that were on the interferon, they just, I don't know what it was. And if you ask me, I noticed that they didn't fare nearly as well. And so yesterday at the informative dinner slash meeting, it did come out. I was talking to the woman who works in the neurological department of a hospital. Again, I don't endorse any of them. I endorse my doctor, but but at the same time, we were talking, and she admitted that the success rate for African Americans, Hispanics that take the shots, so to speak, are the success rate is only 50%. So those are not such good odds, because those are close to the same odds as if you weren't taking anything except, well, I mean, roughly the same odds as if you weren't taking anything but heavy doses of vitamin D, which you all should be taking no matter what, because vitamin D is known to help. Actually, all antioxidants are known to help kind of slow down the progression of the disease, as do many of these medications. Now, the thing about it is that with 50% odds, there's no way that you could get me to trust having scars all over my body, and the pain of injecting myself or someone else injecting me, to have, a small chance, a small chance of getting better. And this is, again, I keep on saying, this is my disclaimer. Everything is different for every MS survivor. So, for some, maybe it does work. For me, it doesn't. And I just want to let you know, talk to your doctor. And this is across the board. The thing about it is, going back to a little bit more about MS, the most common ethnic group, or actually demographic, I'll say, to get this disease are Caucasian women, which the funny part about it is, actually, it tends to be more severe when brown people, when Hispanics, African Americans, ethnic groups, I'll say it like that, when we have the disease, it tends to be more severe for us. Now, also, it tends to be the most severe for African American men. So with that all being on the table of how it works, so therefore there are more, I would say there's more options for Caucasian women, because of the fact that they don't necessarily always, again, don't quote me on this, don't come back and try and sue me. I'm just telling you what I've heard through the grapevine and what I've noticed myself. The thing about it is that Caucasian women tend to respond better with actually the shots, not better than the oral treatments, but better than the brown people. I don't know why. Don't ask me. That's a question for your doctor. And doctors, feel free to chime in anytime. But the one thing about it is this, is that that would be the one thing that I would say. If you are a part of an ethnic group that has a potential to make you brown, please look into taking oral treatments, or talk to your doctors about it, instead of taking the shots. Again, this is what I think. This is, statistically, it's kind of been proven, but I just want you to know that there are possibilities. And of course, I want you all to be fantastic and healthy. And until we find a cure, all we can do is keep on trying to do the best treatment that works for us. Now, don't forget to make sure that you take, that's anybody, any MS patient, that you take your vitamins as you should, and that you try and stay positive, stay around positive people, because stress, at least for me, exacerbates all the symptoms. It doesn't matter what medication I'm on. So I just want to say there are 3, maybe 4 three or four oral treatments that I know of that have been approved. So again, check into any of those. And then there's obviously a lot of the interferon and a lot of other treatments that have been around for decades. But I would say just be aware of your options, just like anything. Don't take the first thing you hear, and don't take my word for it either. I can just tell you that for me, from day one, I said, and thank God that my doctor and my neurologist listened, but I said that I was not willing to even go down the interferon or the shot way, period. And of course my doctor said, well, even if you had to do it, you'd be okay. Yeah, okay, but we're not going to even try that. So so that's what I chose. But I just want you all, there's four. There's the one that I'm on, which I would love to endorse, but at the moment I won't do so. But I endorse my medication, and I endorse actually almost, I would say almost all the oral treatments over the shots, just because I think, just for your own peace of mind, to be able to know that you don't have to wake up with a new scar on your arm somewhere or on your leg somewhere or have a reaction to that. Of course, they all have side effects, and and I'll go through those really quickly, but I know a lot of them tend to have you might have a little bit more fatigue, you might have diarrhea, constipation, some say hair loss, but even with that, it's not drastic. It's just like a temporary thing just while you go through the first cycle of your hair loss, which we do. We lose hair all the time. And then, and it grows back. And yes, I do have hair, okay? I just, again, as I usually do with these, with a lot of the ones for Real Talk MS, a lot of times I roll out of bed and do it. Why? Because I like to talk to you all at the early part of the day, which is usually the time that I feel the worst. So essentially, you are seeing me, I won't say at my worst, but you're definitely seeing me at my weakest point when I come to address you all. Other side effects, there's, they talk about, sex stuff, how it can kind of decrease the sex drive and other stuff. I will talk about sex in another segment very, very soon. Trust me. And but again, that's not everybody. For me, that has not happened. It has at all. But again, I am on the oral treatment. I'm not sure if there's a difference between when you have the shots versus when you take the 1 pill a day or 2 pill a day, whatever. I don't know that. I don't have the answer to that. Doctors, chime in if you'd like. But I'm just saying, for those side effects, a lot of them tend to be actually the symptoms that we already have. It's not like side effects that are completely out of this world. Of course, even before you would take they would start you really on the oral pill, you have to have other tests anyway for like your liver, kidney functions and stuff like that. So I think it's worth a shot. That's all I say. I think the oral treatments are worth a shot, if possible. But if what you are taking and what you are on is working for you, don't change a damn thing. That's all we can do. We can do what's best for us. And that is not across the board, because again, this is not a one-size-fits-all disease. So there is not one medication that serves all yet. And of course, there's still no cure. So we're just pretty much trying to do the best that we can. So again, I just say check into your options, stay positive, and know that this disease is not all of you. It is just a part of you, and that's it. So everybody, God bless. Do your research. Do your research. And of course, talk to your doctors. Now, I'm gonna upload this bad boy real quick, and then I think I'll go back to sleep for a little bit because I'm sleepy. So anyway, have a great day and stay blessed.